Founded in 1996, the Loving Heart Hospice Foundation works tirelessly to raise the funds and awareness necessary to meet the emotional, social, and spiritual needs of the dying and their loved ones throughout Southern California. The compassionate end-of-life care provided here at the Moore Park Healthcare Center features interdisciplinary teams of experienced staff members, all committed to managing symptoms and bring the promise of comfort to their patients.
The mission of Loving Heart Hospice Foundation is to financially support low-income hospice patients with hospice-related services that would not be covered by insurance. The foundation was created when we found a need in the community to help support some of our hospice patients with some of the needs that they need, such as durable medical equipment, medications not covered by insurance, caregiver relief, days in skilled nursing facilities, and funeral and cremation expenses that the family could not afford on their own.
There's a gap between Medicare and health insurance plans and what they cover, what expenses they cover within the plan. And we were able to identify things that are not covered in any health plan or by Medicare or Medi-Cal or Medicaid. That is for caregiver needs at the end of life. We have found that there are several people who have lived beyond their retirement years and have expended all of their financial resources, and sometimes don't even have the ability to cremate or even bury a loved one. We have families with young children that also don't have the ability to provide counseling and services to help them through a grief process.
There are many human struggles and medical issues related to a life-threatening illness. The emotional and spiritual struggles of a patient with a short prognosis are often overwhelming. Once associated with only cancer patients, hospice now provides services that offer comfort and reduce the suffering of any patient battling a disease or condition that can no longer be treated.
We treat a whole variety of terminally ill patients, not only from cancer, but to heart disease, lung disease, neurological problems, and of course the wide range of age groups from childhood all the way up to adulthood.
Quality, comprehensive end-of-life care can be expensive. Getting in touch with the right resources can make a world of difference. Established to help support those who demonstrate financial need, the Loving Heart Hospice Foundation helps defray the costs associated with hospice, so people in the last phases of an incurable disease can be offered complete support and care and live as fully and as comfortably as possible.
Our philosophy of care is always quality of care first. We care more about the patients and the family as a unit, make sure that we are taking care of all of their needs, and that's why the foundation is so important. We use the same methods that like Medicaid, Medicare uses for the low-income patients like Medi-Cal. The qualifications that they require for low income are the same that we require. We make the process very fast and easy. If we get a call that day, we sometimes can qualify within the same day, because dealing with end of life, sometimes it's kind of in a hurry and we need to put caregivers in place right away, so it's something we work on immediately. Some of the other services we provide at Moore Park Healthcare are the skilled nursing from hospice, pain management, symptom control management, and other series of therapies. The donors are very important to us. They continue to support what we are providing here in our community. We have a lot of businesses that also help us. We have even patients that have been, our families have been receiving services, continue to provide finances for us. So we're very grateful for our donors, and we continue to work with them to keep supporting our community.
In addition to providing financial support for activities and services designed to improve the quality of life for needy hospice patients, items funded through the Loving Heart Hospice Foundation often include medications not covered by insurance and funeral expenses.
We have the only granting foundation. There are a lot of hospice foundations that provide volunteer support, but we actually grant the funds that are necessary to provide caregivers, bereavement support, counseling, funeral expenses, as well as facility placement.
While in hospice, a customized plan of care is developed by a patient's attending physician and family caregivers to address the needs of the patient and family.
About a year ago, my mother was diagnosed with esophageal cancer, and she wasn't a candidate for surgery or chemo radiation, so With speaking with the doctor, he agreed that at some point in time she would need to be on hospice. And I actually found TLC through a couple of people, believe it or not, in the obituaries that thanked TLC for taking really good care of them. And they actually helped my wife, my father-in-law tremendously, and all the family members that came in to see her just before she passed away. Everything from the chaplain to the case manager that was there at her bedside when she was needed. The level of care received at TLC was amazing. They just did an outstanding job.
The doctor that was seeing my mom saw that she needed some more care in her house, and he arranged to have hospice come over. And hospice came over many times during the week, provided a lot of assistance to my mom, very caring people. The hospice nurses here and the people were extremely understanding and very caring and loving and provided the support that she needed.
I think the biggest thing that we're proud of is that we take care of the most difficult cases here at Moorpark Healthcare. And difficult because there's no finances. The patients really have some symptoms out of control. There's no family involvement, and they would have nowhere else to go. And it's wonderful to know that we have a place like this that we can take care of patients that have nowhere else to be.
The families are so grateful. They are so desperate for help at this time of their life. They've been through a gauntlet of treatment and doctors and hospital stays and visits. They are so grateful, and it really helps ease the pain and suffering of their loved ones. We are able to get in and really provide the things that they need at the time they need it the most.
I would absolutely recommend TLC. Not only was TLC recommended by reading about it in the paper, but actually the physician that was treating my mother recommended TLC. They did a great job. It's a small foundation. They seem to be more attentive to your needs as opposed to a large foundation, and that really appealed to me.
I know that organization, what they do, the benefits in helping people that are ill or terminally ill, and I just think that the environment here is it's like a home, and it's a very cheerful, pleasant environment, and I don't think you could ask for any more, you know, when somebody is at that point in their life, to be able to live in an environment like this.
Early referrals and advanced planning is extremely important. The main reason is that at the end of life care, if the family member does not have advanced directives, then it makes it extremely difficult to understand what that person would have wanted at the end of his life.
What I like the most is patient care and being able to interact with the families and know that because we do a good job, we've made a difference.
I always light up when I think of Shelley, only because we've been together for so long, over 16 years, and we think so much alike. We have the same values. We really want to help people, and I think every year we do better, and that's such a wonderful thing to do.
We are very excited about our foundation and our upcoming events. We plan to do many more galas, walks, anything that would help focus the community on what we do at Loving Heart Hospice Foundation. We are passionate about what we do at Loving Heart Hospice Foundation, and that we are able to be there for the patient and their families to provide them the quality of life when the quantity of their life is so short.
When time is short and medical science has no more to offer, hospice is a family affair that offers the promise of comfort. Learn more about how the Loving Heart Hospice Foundation is helping to ensure quality of life at the end of life. For more information or to donate, go to lhhfoundation.com or call the number on your screen.